Bismillahirrahmanirrahim. My name is Dr. Amber Rashid, and today my topic of presentation is monkeypox under supervision of Professor Dr. Zahra Afzal. In this presentation, I shall be discussing what is monkeypox, how it was originated, the global burden, how it is presenting currently in Pakistan, epidemiological triad, prevention and control, some recent updates, and an MCQ session at the end. Therefore, at the end of the presentation, the participants will be able to describe the epidemiological features along with prevention and control measures suggested for monkeypox recent outbreak. So, monkeypox was first discovered in 1958, and there were two outbreaks of pox-like disease or smallpox-like disease, and it first occurred in the colonies of monkeys that were kept for research. Hence, the name monkeypox was derived. And the first human case was first reported in Congo in 1970. During this period of intensified effort to eliminate smallpox during that period. And since then, monkeypox have been reported in several African countries, including Congo, Liberia, Nigeria, and other countries. But most of the infections have been reported from the Democratic Republic of Congo. So there has been several outbreaks since 1970, the era where the efforts were being done for the eradication of smallpox. And it was a 9-year-old boy in Congo that had the first case, as that was identified as the first case of humans of this disease. Similarly, in 1996-97, there was an outbreak in the similar region, but with a lower case fatality ratio and higher attack rate than usual. And that was concurrent outbreak of chickenpox and monkeypox afterwards in the specified regions. In 2003, the first monkeypox outbreak was outside Africa, and it was reported in United States. And it was linked to the contact with infected pet dogs. And over 70 cases were reported at that time in US. Since 2017, the African countries, especially Nigeria, has experienced large outbreaks with over 500 suspected cases and 200 confirmed cases, and the case fatality ratio of 3%. Similarly, there was a traveler-related monkeypox cases in September 2018 in United Kingdom in year 2018, 19, 21, and 22. The cases have been reported. Similarly, in Singapore in 2019, and in United States of America in July and November 2021. But in May 2022, multiple cases of monkeypox were identified in several non-endemic countries, and Pakistan is also on the high alert since then. So these were the latest updates regarding the cases that were identified in different non-endemic countries, and the highest number of confirmed cases in UK, Portugal, and Spain, and later on 1 to 5 cases in other developed countries. So this is the geographical map of showing the distribution of suspected and confirmed cases between 13th to 21st May. And it includes several areas like Australia, Canada, Germany, Italy, as shown in the previous table. And these are the figures of monkeypox that has been reported from endemic countries between 2021 to May 2022. And the number has been high, as you can see, in Democratic Republic of Congo. And other countries have also been continuously being reported in African countries. So as regarding Pakistan, there has been a tweet recently regarding the monkeypox cases, and it is clearly shows that now till 24th May, no case of monkeypox have been diagnosed in Pakistan. And the news were all speculations and rumors regarding the confirmed cases in Pakistan. So this was a case study that was a case of monkeypox in a return traveler. Actually, it was happened on June 30th, 2021, where 5 days after having arrived in Nigeria, a person stayed several returned to Nigeria after 5 days. And he was having cough, fever, diarrhea, and vomiting. And then on July 8th, he developed purulent skin eruptions. And the following days, his fellow to Dallas, he flew to Dallas with a brief stopover to Atlanta, and he traveled after having the skin eruptions. And on July 13th, he was driven to hospital by a friend after worsening of the rash. So the man was immediately placed in isolation, and the emergency department reviewed the information from Nigeria centers, and it was monkeypox. The diagnosis of monkeypox was confirmed on the following day, and later on he was uh, confirmed by this having a DNA of monkeypox. So it was a confirmed case of monkeypox who traveled to Atlanta. Epidemiological triad includes the agent, that is the monkeypox virus. It is a double-stranded DNA virus and is a orthopox virus. And genus includes Virola virus, the vaccinia virus, that is for smallpox, and the cowpox virus. Um, the natural hosts are some animals like squirrels, rodents, and the natural uncertainty remains on the natural reservoirs of the monkey virus, and further studies are needed to identify the exact reservoirs and virus circulation. So the currently the hosts are the squirrels, the rats, the and other these kinds of animals. Um, the main reservoir, the information is still unknown, but the African rodents are suspected to play the most important part in the transmission since the outbreak or the first reporting of the case. And actually, the incubation period of this disease varies 7 to 14 days, but its total ranges 5 to 21 days. That is the peak or the highest level till the disease can extend. But mostly, monkeypox is a self-limiting disease, and it lasts for 2 to 4 weeks. It's been seen that for individuals who has been exposed to virus, the temperature and symptoms should be monitored twice for 21 days, because this is the accepted upper limit for monkeypox incubation period. So pathogenesis include two phases: the invasion phase and the skin eruption phase. So in the invasion phase, it lasts for 0 to 5 days with fever, intense headache, and lymphadenopathy. That is the distinguishing feature of monkeypox from smallpox and chickenpox and measles. So lymphadenopathy actually distinguishes it from other similar rash diseases. So the lesion progresses between 1 to 3 days from macules, papules, vesicles, pustules, and ends in a scab, and usually lasts for 2 to 4 weeks. Skin eruption phase begins within 1 to 2 days after the appearance of fever, and it affects the face, then palms and soles, and later on it goes to oral mucosa, genitalia, and even to cornea. And the number of lesion varies few to several thousands, and they also coalesce until the large skin section of the skin is peeled off. Signs and symptoms include basically the fever, headache, muscle aches, backaches, and the lymphadenopathy that is distinguishing. There are also several complications that have been reported regarding these infections, with secondary infections like bronchopneumonia, sepsis, encephalitis, corneal infections, and the asymptomatic infections may occur, and to what extent that is not known. The case fatality ratio of the monkeypox has varied from 0 to 11% in the general population and has been higher among younger children. And in recent times, the case fatality ratio has been around 3 to 6%, mostly in the African region, Congo, and Nigeria. For regarding the laboratory testing for this virus, the confirmatory tests have been declared as NAT, that is nucleic acid amplified testing, and real-time PCR or conventional PCRs to detect the virus DNA. And the recommended specimen for this diagnostic techniques is the skin lesion material, including the swabs, the exudates, and roof of more than one lesion and lesion crust. All test results, positive and negative, should be immediately reported to the national authorities. That is the recent guidelines. Transmission is mainly through direct contact, and human to human transmission is from the close contact with respiratory and skin lesions and contaminated objects. Transmission via droplet respiratory particles usually requires prolonged face-to-face contacts, otherwise it's minimal. For the treatment, currently there has been no proven and safe treatment for monkeypox. Supportive treatments with smallpox vaccines, antivirals, and vaccinia immunoglobulins has been used. These drugs, these codofovir and these drugs, antivirals, have been used, but there has no data available for the effectiveness of these in treating human cases. And there has been serious renal toxicity or other has not been observed during the treatment of other infections, but this is still under study. Similarly, for this drug, the studies has been done on animal species, but human clinical trials were also done and indicated it was safe and tolerable with only a few minor effects. So currently, these drugs have been stockpiled and are under regulations and under observations. Also, vaccinia immunoglobulin has been administered, but has no proven benefit in the treatment of that was originally used for smallpox, but has also been used for monkeypox infections. And the patients who have been having a severe monkeypox infection will benefit from the treatment with this VIGs. Prevention is general prevention that includes to avoid contact with animals that harbor the virus, to avoid contact with any material or bedding, isolate the infected patient from others who could be at risk. And good hand hygiene is important with soap, water, and hand sanitizers, and use of personal protective equipment that includes the masks, the gloves, when caring of the patient or the case. Additionally, correct containment and disposal of waste with care for handling the patient care equipment as well. As far as a vaccine for the disease is concerned, this JYNOS that is originally used for the smallpox has been administered for the prevention of this monkeypox. And from a clinical study on immunogenicity of this vaccine, the efficacy data is taken from the animal studies, and experts believe that vaccination after the monkeypox exposure may help prevent the disease and make it less severe. So vaccinia vaccine used during the smallpox eradication program is protective for monkeypox. A new third generation vaccinia vaccine has now been approved, and that has been approved for both smallpox and monkeypox. And recently in UK, a smallpox vaccine, M1X, is the recommended vaccine for post-exposure prophylaxis. And vaccine is most effective if it is given within 4 days of exposure, but it can also be given up to 14 days post-exposure if required. So in some cases, post-exposure vaccination with modified vaccinia and Cara vaccine is also recommended. And according to CDC, as I've already shown, that it's ideal to give it within 4 days of exposure to prevent disease onset, and vaccination within 14 days to reduce the disease severity. Surveillance is important, and the key objective of the surveillance and case investigation for monkeypox is to in current context is to rapid identify the cases, clusters, and the source of infections. And contact tracing is also very important to prevent the further transmission, and and tailor the effective control and prevention methods based on the most identified routes of transmission. So there are several case definitions that has recently been updated by WHO. What is a suspected case? A suspected case is a person of any age in a monkeypox non-endemic country, or with an unexplained acute rash. This is for a non-endemic. Or a patient is having one of the following symptoms like headache, acute fever, lymphadenopathy, myalgias, back pains. And if a person with unexplained acute rash during this period is having a negative laboratory test, first laboratory test is negative, then we cannot list the person as not a suspected case. We will do further testing to rule out and confirm it as a discarded case of monkeypox. So first negative laboratory test does not rule out a suspected case. Probable case is a person meeting the case definition for a suspected case, and also one of the following, like having an epidemiological link, like some close contact with the person within 21 days, reported travel history, had a multiple anonymous sexual partners in 21 days before onset of symptoms, have a positive result of this virus serological assay, and has been hospitalized for some minutes. A confirmed case is that who has been confirmed with the detection of this sequence of viral DNA either by real-time PCR or sequencing. And a discarded case is either a suspected or a probable case for which the laboratory testing for PCR or sequencing is negative for monkeypox. Like first, it was done for suspected and probable case, and it came out negative, and then it was again repeated after several days. And if then it comes negative, then you can label it as discarded case. Reporting is very important, as a case report includes all these points that has recently been updated, and it is must to report all these points and report to the national authority according to HIR, international health relations. So the date and reporting, name, age, gender, with recent exposures and recent history of multiple partners with smallpox vaccination status, and the detailed reporting is required. For non-endemic countries, one case is considered as an outbreak. And because of public health risks associated with single case of monkeypox, clinicians should report the suspected cases immediately to the national or the local public authorities, regardless of whether they are also exploring other potential diagnoses or not. So reporting is must. So WHO suggests an outbreak case definitions that are still under development. For surveillance case definitions during a serious outbreak, a suspected case is a person with acute illness with fever of 101, with intense headache and lymphadenopathy, followed 1 to 2 days later by progressive rash, and then spreading elsewhere on the body and including the palms and soles and feet. A probable case that meets the clinical definition and is not laboratory confirmed but has an epidemiologically link to the confirmed case, then it becomes a probable case. And the confirmed case is a clinically compatible case that is laboratory confirmed. So these are the simple outbreak case definitions suggested by WHO. So for the control measures, infection control is important both at hospital or if the patient is kept at home, or regarding animal or travelers. So first, coming to the hospitals, if a person is going to a hospital, and precautions should be taken to prevent this transmission. So a combination of standard contact and droplet precautions should be applied. The guidelines have been given on CDC. Isolation is must, with the ideally in a negative air pressure, but if not available, then you can isolate the patient in a separate room with placing a surgical mask over their nose and mouth, and covering any patient's exposed region with the sheet and the gown. That is important. And the personal protective equipment for other people dealing with them or the healthcare workers is the disposable gown, the gloves, and the N95 certified masks. For if home, the person with extensive lesions that cannot be easily covered should be isolated in a room, and a person with monkeypox should not leave home except as required for the follow-up care. And household members who are not ill should limit contact, and pets should be excluded from the ill person's environment. And this is also important to prevent monkeypox through restrictions of animal trade. So some countries have put in place regulations and restrictions of rodents and non-human primates. And any animals that might have come in contact with an infected should be quarantined and handled with standard precautionary and observed for symptoms for 30 days. So new guidelines according to CDC for the travelers to prevent the monkeypox. So it's avoid animals when traveling, do not touch live or dead animals, and do not touch or eat the products that come from wild animals. And also wash your hands with soaps and water and alcohol, and a hand sanitizer with at least 60% alcohol is recommended. And keep your hands away from your eyes, nose, and mouth. And avoid close contact with people who are sick. So these are the guidelines that majorly for the travelers. So regarding Pakistan, these were the Urdu guidelines for the disease, and this whole document is shared on the websites. And this is the general awareness or the awareness flyer for the people in basic native language, and also in this English language, that has been provided by Al Khan University on 23rd May, with the showing with all the epidemiological features, the modes of transmissions that have been explained, with presenting complaints, the similar incubation periods, infection control measures, and it's a precise document with lots of information. With the recently reporting, no monkeypox case has been reported in Pakistan yet, and Karachi health authorities have has confirmed that no suspected case of monkeypox has far been diagnosed in Pakistan. And it is also emerged that most Pakistani laboratories, that includes NIH, Khan, Dow, and lacked the ability to detect monkeypox virus. That can be a serious problem later on if we face a huge outbreak of this disease. So Pakistan's top health body issues monkeypox alert, and Islamabad, the federal and the provincial health officials are put at high alerts. And the bodies said that all big private and government hospitals are directed to establish isolated wards. And it's also advised that medical staffs of hospitals to be careful around monkeypox patients suspected. Till now, it's suspected, all suspected. So these are some of the surveillance sites or some notification regarding the high alert, and some of the people who has been designated some duties under these sites in Karachi. And this was also a notification for a multi-country monkeypox outbreak that was issued on 23rd May. So a few recent updates. Monkeypox unlikely to be COVID-like pandemic. What this article says is that Pakistan, like as I have already told, that Islamabad has issued a high alert situation in Pakistan, and several hospitals are collaborating and are updating the prevention and control guidelines, are working in collaboration. And also, the experts believe that monkeypox is less likely to become a pandemic like COVID-19, despite being a zoonotic disease. But still, there has been a high alert. And this has been a changing epidemiology of human monkeypox, but is a potential. And this was a systematic review that was recently published. It shows the different case fatality rates, the changing case fatality rates, and the findings in different endemic countries and other countries. And this systematic review actually shows that the cessation of smallpox vaccination, which provided some kind of cross protection against monkeypox, is leading to increased human to human transmission, and that is one of the reasons that has been identified. So increased surveillance and detection of monkeypox cases are essential tool for this changing epidemiology of this disease. So now it's time for the MCQs. According to the recent reports of monkeypox, a virus has made an appearance, drastic and a huge appearance in which of the following countries, causing a lot of trouble. Either it's Germany, it's UK, it's Finland, Italy, or Russia. Any idea?
B.
Yes, it has been UK, because in UK there has been a large number of cases reported, and they have also provided guidelines for mass vaccination, post-exposure vaccinations. The vaccine used against monkeypox was originally used to eradicate which of the following? Either it was live smallpox, live cowpox, a genetic recombinant killed virus, or a combination vaccine.
A.
Yes, it's A. It's a live smallpox that was originally used and was used for this monkeypox disease that had shared some kind of cross immunity. The purpose is to limit the incidence of disease by controlling the monkeypox virus and risk factor using mass education and this vaccine program. This whole is a part of primordial, primary, secondary, tertiary, or quaternary prevention.
B.
That's part of the primary prevention, and it's very important to emphasize on this part, because this is the only way that we can control the transmission in non-endemic countries, and mass vaccination and education program can limit the disease in early stages. The reservoir host, the main disease carrier of monkeypox, is still unknown, but some animals are suspected to play part in transmission. Which of the following has the main roles? The African rodents, the squirrels, the cats, dogs, and monkeys. Yes, the African rodents has been the suspected, but still the main carrier of the disease is still unidentified, and work is being done. In May 2021, a family returned to United Kingdom after traveling to Nigeria, and 3 family members became infected with monkeypox virus. The sequential timing of symptoms developed on 0, 19, and 33rd days. Which of the following would be the best control measures to limit this human-to-human transmissions at this point when the person is symptomatic? Give antivirals, give immunoglobulins, isolate the patients immediately, reconfirm the monkeypox, give antibiotics to improve the symptoms first.
C.
C is the right answer, because isolation is key as it spreads from the secretions, the close contact. So isolation is essential and key to control this human-to-human transmission. Monkeypox is a viral infection that resembles smallpox. Infection that occurred earlier were probably diagnosed as smallpox because of similar clinical findings like fever, headache, myalgia, fatigue. A key differentiating fever of monkeypox from smallpox is renal dysfunction, lymphadenopathy, bone marrows, deranged LFTs, LDS levels, and severe GI symptoms.
B.
Yes, B
Lymphadenopathy.
is the right answer, lymphadenopathy. And whenever we are examining a person with or either it's a suspected, even it's a suspected due to monkeypox, we must look for the lymph node, complete lymph node examination. Surveillance is rapidly identifying cases as soon as possible to control the spread and immediately report to the higher authorities. Which of the following is as important as case detection during surveillance? Either it's contact tracing, treatment of cases, provision of free medication, relief camps for underprivileged population, or vaccine campaign.
A.
Yes,
A.
contact tracing is very important during this whole surveillance, other than this case detection and early reporting. So from 2011 to 2014, health officials in North Kivu investigated 4 individuals. Diagnostic specimens were submitted. for which the first laboratory testing for PCR or sequencing is negative for monkeypox. Such cases: probable case, suspected case, confirmed case, discarded index case.
Delta.
It's a suspected case, as I have not written that there was some kind of epidemiological linkage, that is the close contact or a contact history is not mentioned here. They were only investigated on the basis of some symptoms. The first diagnostic specimen that was taken negative for such case, that labels it as a suspected case. A 73-year-old woman with cirrhosis reported a fever, cough, fatigue, and a rash on May 6th. CT was done, and bilateral lungs and bronchopneumonia was there. Lymphadenopathy was also positive, and the patient was admitted in hospital for decreased oxygen saturation. The probable diagnosis would be COVID-19, complicated monkeypox, measles, mumps, or smallpox.
Complicated monkeypox.
Yes, it's complicated monkeypox. Similarly, resembles the clinical representation of COVID-19, but when there is lymphadenopathy with bronchopneumonia and rash and fatigue, then it's complicated monkeypox. And last is, for the individual exposed with virus, temperature symptoms should be monitored twice for how many days. That is accepted as upper limit for the monkeypox incubation is 14 days, 21 days, 7 days, 3 days, or 10 days.
B 21
B.
days.
Yes, it's 21 days, and this, the emphasis on this 21 days is important because until then the person must kept in isolation to limit this person to person transmission. This is the key, and thank you.
Thank you very much, Dr. Amber. Very nice and wonderful presentation on a very recent topic, monkeypox. And I'm so glad that in such a short time you have prepared it very well. And it is very important to spread the message among the public to decrease this mental stress that is spreading each day. And I know that many people, they have a lot of fear about monkeypox and even other diseases. They are mixing it with the one of such case has happened in Lahore, as you know, a case of pemphigus vulgaris. It was misdiagnosed as monkeypox, and he was labeled as the suspected case of monkeypox. Later on, it was proved that he is the known case of pemphigus vulgaris, and similarly another case of herpes simplex, and another case of chickenpox. They were misdiagnosed as monkeypox. So there is a lot of misinformation is going on. So this is the right time to spread the correct information, authentic information, and reliable resources for the further consultation, not only for the general public, but also for the medical professionals. Many advisories have been issued, as you have shown, from Aga Khan, as well as from other health authorities. However, still there is a lot of work has to be done for communication. Very well done. We are really proud of you, and how you have presented it. It really is commendable. Thank you very much.
Thank you so much, ma'am. Lapis.